Good morning, Med Center. Welcome to our town hall meeting. I want to first thank everyone for their amazing work that they've done throughout this pandemic. It is a marathon, and although this has gone on for a while, we need to keep things up. We need to keep our masks, keep washing our hands, keep staying away from each other. But I want to thank everyone for the amazing work that they're doing here at the Med Center. This week is Physician Assistant Week, and we celebrate and acknowledge our physician assistants. The PAs are invaluable members of our team who work with our physicians and provide really high quality care here at LAC+USC. So thank you, PAs. This Saturday at LAC+USC, we'll be hosting a community flu shot clinic at the Wellness Center right on State Street from 10 a.m. to 2 p.m. And anyone can go without an appointment. You don't have to be an employee. Any community member can go. So please spread the word. An important community event. Some recognitions. We want to recognize Team A in adult specialty clinics, OPD 5P1, particularly Veronica Hess and Gaetana Canovas. Veronica consistently goes above and beyond for her patients and her fellow coworkers. She's been active in the retraining of nursing staff to move to the clinic setting. And Gaetana supports a large volume of patients. She does all the screening and patient intake all by herself. So thank you, Gaetana and Veronica, for your hard work. We also want to recognize the UR and case management community home health nursing staff who continue to work on utilization management initiatives, ensuring patients are safely discharged, and out-of-network patients are transferred back to their home hospital. Very important work. Thank you, UR and case management. And then lastly, a shout out to all the staff who have been working hard to promote Don't Wait, Vaccinate campaign. We're on track here at LAC+USC to set a record for ourselves in terms of flu vaccination percentage of our staff. So keep up the great work. We want to show a few of the photo competition winners. So for week 1, Jackie Foster, thank you for your submission. Week 2, Ricardo Rodriguez, thank you for your photo showing vaccination, the joy in vaccination. Belkins Wilson submitted a photo for week 3, so thank you so much. And then we had a contest, a unit winner. I believe it's Pediatrics OPD 5 East. Not sure, but here's the picture of the winner. So thank you. Reminder, the prizes include VIP parking, coffee with the world famous Dr. Spellberg and Dr. Holtum, and myself. CARES gift cards weekly, and coffee and pastries for unit winners. So please keep up the spirit, keep up the energy. Trivia question. Does anyone have a trivia question?
Here's a trivia question. We have a trivia question, okay? So news media reported that when the president was being treated for COVID-19, one of the treatments that he received, which we use all the time in our hospital for hospitalized patients on oxygen with COVID-19, was dexamethasone. Name one major side effect of dexamethasone. That's the trivia question.
Okay, Dr. Spellberg.
All right, welcome to Wednesday Soothiness, your soothing thoughts for the week. And the graphs that I'm going to show you continue the soothing story. So the top graph, which shows you the number of positive COVID-19 tests at LAC+USC since mid-March, we have a continued steady decline in positives. Way off the peak, down 5-fold essentially from our peak in terms of positives. So that's all very reassuring and is mirrored by the county-wide data, which is the bottom graph showing the number of new positives reported by LA County Department of Public Health per week. All of this is very comforting and reassuring. We have not seen a spike. We did have that blip up post-Labor Day, but have resumed our downward trend, which is all very nice and comforting and soothing. And I will remind you, while you are soothed and soothing and feeling relaxed and happy and pleased, let us simultaneously also not let our guard down. We still do have 30 COVID positives in the hospital. We were down to 8 in the ICU at one point. We were back up to 10 in the ICU. So we're starting to see a plateau phase of this decline. And we still do have concerns about the potential for a spike back up in winter. So this is not the time to let our guard down. Let's keep trying to move our COVID-19 patients through the continuum of care. And I will also point out our regular patients are coming back to us. Our inpatient census yesterday and today overall were as high as they have been since the end of March. So patients are starting to come back, and we do need to continue to try to move patients through the continuum of care so we don't fall behind, especially if COVID-19 recurs in the future. And the final thing I'll say is I am feeling particularly personally soothed today because of this sticker on my badge. Don't complain about 2020, go vote. I dropped my vote in the mail yesterday, and it was a fantastic feeling, I gotta tell you. Drop your vote in the mail. Get your vote in. That will make you feel so much better. Trust me on this one. Dr. Holton.
Thank you. Can we vote COVID-19 not to come back next year?
I wrote it in as a candidate. No more COVID-19. Good idea.
Just one or two quick thoughts. As Dr. Spellberg said, first of all, the number of cases of COVID-19 has gone down. The number of non-COVID-19 patients who we are seeing both as an inpatient and an outpatient are coming back up. There is some anxiety because all we've been doing for the last 7 months is caring for COVID-19 patients. We all know how to safely care for patients who don't have COVID-19. We all know how to safely care for patients who have COVID-19 as well as those who don't. And so we just need to use all of the information that we have gained, all the knowledge we have from the last 7 months, as we begin to move into a different kind of world where we're seeing patients who have COVID-19, patients who don't, and outpatients who we don't know at the moment. We know how to do this. We can keep safe, and we should continue to do that. Secondly, as mentioned, we need to continue to promote influenza vaccine. Amazingly enough, it's actually fall, although it feels too hot to be fall, I must admit, but we're actually in the month of October. Public Health has said that all healthcare workers must be vaccinated by November 1st. And a while ago, that seemed a long time off, but honestly, that's just a few weeks away. So I encourage all of you, get your influenza vaccine. Employee Health has many ways to access it and get it. Please get your influenza vaccine. And if you really want to be safe and care at all for your family, get your family to get the influenza vaccine. Not only because you love them and you don't want them to die, but at the same time, you don't want to get it from them. Get people around you vaccinated.
Great, thank you. To our questions. We are live. Please submit your questions. We'll try to get to all of them. Dr. Spellberg and Dr. Holtum, what are your thoughts on the president's health? Was he shedding virus all over the place?
Would you like to start?
Sure, I can start. Many times we hear about people who are VIPs, and press conferences come and people say different things about their health, and various bits and pieces of medical information come out, and then everyone who wants to be on TV rushes to opine as to what their condition is, how likely they are to die or get well, and whether or not their doctors were idiots or Nobel scientists who were brilliant in their therapy. The answer is, of course, I have no thought on his health because I have no information on his health. The information that we get is fragmented at best, and so there's no way for me to make an intelligent statement about his health or not health. The people who know are the people who have more data.
Yeah, so I mean, just feeding that sentiment. It's very dangerous for us to play Monday morning quarterback with incomplete information. We don't know what the situation was. It's not fruitful to speculate on what the situation was. And so I think all of us probably have much higher priority things to be concerned with day to day. It is what it is. It's hard to say. The one thing I think we can confidently state is, since he did test positive and apparently had symptoms, he was shedding virus at some point, because everyone who's positive sheds virus at some point. The extent of which we don't know, and the treatments and all that stuff is prognosis. We don't have enough information to say.
According to an article in Medical News Today, a large nationwide study revealed that less than 10% of the population in the U.S. had formed antibodies against COVID-19. What does this mean regarding herd immunity?
It means we ain't got no herd immunity. That's all it means.
That seems to be a relatively safe statement. Whether or not the antibody test reveals that you actually have immunity is another question, but even if it did, less than 10% doesn't get anywhere close to giving herd immunity.
Yeah, we need a vaccine, folks. Herd immunity achieved via a functional vaccine is a realistic option for us that we can hope to have within the next, say, for example, 6 months. But natural herd immunity, if we have to go that route, then we're looking at the 1918-1919 pandemic. Took 2 years. I don't think any of us want that to be the way that we go.
If we really want to go toward herd immunity, we should tell people to stop wearing masks, stop social distancing, get together in large parties, and at least infect everyone.
Just to get it over with.
Just to get it over with.
Yeah, that's the Thanos plan. Let's invoke the Thanos plan from the Avengers. Yeah.
Okay. Another study, a small-scale study, has concluded that hospitalized patients with COVID-19 are less likely to have life-threatening complications if they have sufficient levels of vitamin D. Is this true? Would vitamin D supplements help with this?
Well, it is true that a small-scale study found that information. If you're asking a different question, does that mean that giving vitamin D to everyone with COVID-19 will improve outcome? That wasn't actually demonstrated by this small-scale study. In fact, there have been several studies that have come out of a variety of vitamin supplements. Have there not, Dr.
Oh, indeed.
Spellberg?
I would actually say, so but there have been multiple studies of vitamin supplements with COVID-19, none of which have shown change in course. I think more importantly, numerous diseases have been shown in observational studies to have a correlation between vitamin D levels and bad outcome.
Including tuberculosis, by the way.
Including tuberculosis. And in multiple of those diseases, people have then gone and done randomized control trials where they have treated those patients, including tuberculosis, with vitamin D, and there has never been a benefit. Why is this? People who are vitamin D deficient or who have low levels of vitamin D are people who are not active. They're not going outside. They're not getting out of bed. They have poor nutrition at baseline. When those people get tuberculosis or COVID-19 or malaria or any of a variety of other diseases, they tend to do worse because they were sicker before they got the illness. Giving vitamin D is not the solution. So this is a correlation, not causation. And given the multiple, probably 24 randomized controlled trials of various vitamin supplements, including D, for numerous disease states that are infectious, none of which have ever shown a benefit, it is very unlikely that giving vitamin D will make a difference for COVID-19.
We could flip that and say if someone has COVID-19 and is vitamin D deficient, they should receive supplementation. The other side to that is vitamin D is one of those vitamins, unlike vitamin C, that if you take a large amount can actually cause harm. Yeah. Vitamin C, if you take a lot of it, it passes through your body into your urine and it doesn't hurt you, just waste money buying excess vitamin C. But vitamin D in high levels can actually cause toxicity, so it's a vitamin that one would be cautious with.
Yeah, I would just say get some sun and drink some milk.
All right. Dr. Holtum, if you were President Trump's physician, would you have recommended the president stay in the hospital?
Well, the first part of my answer to that is what I just said, which is I have absolutely no idea because we don't know enough about what his actual condition was. That being said, we have in our hospital a very active program of taking patients who are medically stable but have low oxygen levels, giving them home oxygen, sending them home, and having aggressive follow-up. In point of fact, that has been a huge program here, and we have looked at that, writing up a manuscript right now about the outcomes. The outcomes are very, very good. We've been able to avoid a lot of hospitalizations and get people home safely to recover at home. So going home in people who are not terribly ill but are hypoxic is what we do here.
Yeah, being in the hospital, there's nothing magical about being in the hospital. You need to be in the hospital if the care you're receiving can only be given in the hospital. If we can give that care out of the hospital, it is much safer to give it out of the hospital for a variety of reasons. So if his need was oral treatments and oxygen, that absolutely does not need to be delivered in the hospital. The flip side is we do expect people to self-isolate. And so if someone is wandering around the streets outside especially without a mask on, that wouldn't be ideal. But there's nothing intrinsically that would suggest that someone whose sole need is nasal cannula oxygen would need to be in the hospital.
How often do staff in the COVID wards get tested?
So we are down to one cohorted unit for COVID-19, given that our COVID census in the ICU is now down to 10, or is at 10. And so it's no longer plural. We hope that we don't have to go up to plural wards instead of singular ward. We'll see. But in the meantime, as we've discussed, I think repeatedly in the past, we do not test asymptomatic people. We do not believe there is a reason to do that. We do not believe the results are interpretable. So staff get tested if they have symptoms. Anything you want to add to that?
No.
Okay. Have there been any layoffs that were supposed to happen in October? The answer is no. The county will not be going forward with the planned layoffs in October. Doesn't mean they might not come back to this plan, but they've canceled the initial plans of layoffs in October.
And DHS was exempt from that, was it not?
Yeah, and DHS, which we are part of, was exempt, so none of the hospitals or clinics were going to be impacted by layoffs anyway. So, are there any studies that say that driving with the windows down decreases the chances of getting COVID-19?
I am not aware of such studies, and I like driving with the windows down because it's hot. I'm
so sorry that you don't have a car that has air conditioning.
I do have a car that has air conditioning, but I like planet Earth, and since the car is electric, if I can just lower the windows rather than using the electricity for air conditioning. Not on the freeway because the air quality is not good, but when I'm driving on...
Besides that, it increases aerodynamic drag and actually increases the work of the engine.
But so it's trade-off, right? So it depends on the rate of speed. All these calculations, Tesla has a whole website on when you should use air conditioning versus roll your windows down for maximal electric efficiency. Yes. Please please add your thoughts.
My thought would be if you are driving in a car with someone who has active COVID-19, I would keep all of the windows down. If you're by yourself, I don't think it would change anything.
Can I just add as a caveat, please don't drive in a car with a patient who has active COVID-19. Yeah.
That you know of.
That you know of.
All right. Go Lakers, Dodgers, bring it home. We have a video that I'm not sure what the video is going to be talking about, but it's about the census. The census is so important. Be counted. If you have not filled out your census form, it takes literally 2 minutes, and it counts you. And the government uses the census to allocate resources and representation throughout the country. So this is a very important activity. So enjoy the video.
My name is Dr. Rangasamy Ramanathan. It's a long name, so everybody calls me Dr. Ram. I've been at LAC+USC Medical Center for 36 years. So we take care of the sickest and smallest babies. With the COVID pandemic, we see pregnant mothers testing positive for the virus. It increases the risk for stillbirths and preterm delivery. There is no way we can run a service like LA County public hospital system without funding from the federal government. If you have accurate census count, the more funding you get. Filling in the census is absolutely crucial. Everyone counts. It is not only helping your own, you're actually helping your neighbors. It doesn't matter what race, what religion, what background, what gender, or what nationality, whether you're citizenship or not. It's totally private. You can do it on the phone or online. It's very crucial to have a facility that can care for the sickest and smallest babies.